Welcome, Flow Getter. It's time to move with purpose and flow with ease.
What's up, Flow Getters? Dr. Danielle here to take you through 2 self-care techniques for potential management of low back and or pelvic pain issues. Now, today we're targeting your glutes using the foam roll, as well as opening up the lateral rib cage and side body for a nice stretch while incorporating our breath. Now, some key things I want to point out first before we get started in order to make sure you're doing this properly at home and to not aggravate or cause any additional issues on top of what you may be experiencing. But as well, it's important to consult your doctor before you get into any type of foam roll program. So the key points I want to point out here are along your hips. This is your pelvis. So go ahead and put your hands on your pelvis and then slide your fingertips down until you start to palpate 2 bony prominences on the side of your hips. Okay? So I'm going to turn to the side so you can see. This area is called your greater trochanter, and we want to stay off of this area when you are on the foam roll. For the reason being, we have a bursa kind of around this area that if we roll and put too much pressure on, we could potentially aggravate. So just create some awareness of where that point is. And then once you find that, I want you to bring your fingertips back up and then palpate along your glutes until you find a potential tender spot of your own. So I have one right about here. So after you find that tender spot, kind of make a mental note in your head. It's about right here, and then you're going to take your foam roll, place it horizontally across the mat, and then you're going to come into a kind of a side sit position and feet out to the side. The bottom leg is going to be resting on the ground, and then your top leg, you're going to put your foot flat on the mat and the hip in slightly an external rotation. This foot is going to be the driver of a very small motion. Coming down onto your forearm, you can use this hand on the ground to lift, and then on the foam roll, go back to that tender spot you had palpated. So there's that spot my brain remembered. Making sure you're not shrugging here at the shoulder, so trying to keep length from here away from your shoulder. And then what you're going to do, using this hand for stability if you need, take a deep breath in. And as you exhale, I want you to think about melting your body weight into the foam roll as you exhale, at a level of discomfort that is tolerable for you. So if you're finding that this is way too intense, push through this elbow to lift your body weight up. So you're going to inhale and then exhale, taking pressure off the shoulder and then letting your body melt into the foam roll. Okay? Now you're going to do that sequence for a total of 10 breaths, or until you feel that tenderness dissipate or kind of melt away. And that's the goal. We're just trying to release some of these tender points along your glute. And then what you can do, using your foot as the driver, you can move up the pelvis. Remember, we're trying to stay below or above that greater trochanter. So if you move your foam roll and start hitting that bony prominence I was talking about at the beginning, move off of it, move up, okay? You can also find areas in your glutes if you open up at the pelvis, moving this foot further back towards the wall, and yep, there's another spot for me. So once you find a new spot, incorporate that same sequence of inhaling and then exhaling, melting body weight down into the foam roll. What I don't want you to do is any type of aggressive rolling motion. Ow. Not good. That could potentially exacerbate whatever's going on. We want to use controlled breaths and just melting using our body weight. That's all you need, guys. You don't have to do any aggressive rolling techniques here, okay? So, moving on to the second self-care practice, opening up our side body, going back to some self-palpation. I want you to take your hands and feel where your rib cage, the bottom of your rib cage is, and then squeeze in. Okay, so mine's right here. What we want to protect is your low back with this specific self-care technique. So by palpating your rib cage, you understand that the foam roll is to only make contact from this point and up on your lateral side body. If for some reason the foam roll contact moves below this area, you are at potential risk of harming your low back. So we are trying to stay above our rib cage. Coming back into a side sitting position. Now what we're gonna do is move the foam roll. Again, palpate your rib cage, and then you're gonna come down to your forearm. Find an area that is tolerable for you to make contact along that rib cage. So I found a nice area here. Now you're gonna keep your legs stacked, and to protect your back, you're gonna bring your knees into a fetal position. And then from here, we're gonna take a deep breath in, and it's kind of like a side crunch. And then exhale, and as you exhale, you're just gonna slowly lower and hold. Inhale, lift up. Exhale, lower down. And then once you find a tolerable spot, you're gonna hold it here and just incorporating the breath. So breathing in and out for a count of 3 breaths. And then you can come back up. If you need a break, you can always use this hand to stabilize and push back up. And if you would like, then you can go ahead and find a new spot or area to work on with the foam roll. So just moving, again, recommending moving the foam roll up your trunk, not down. So I can move it up here a little bit, using this arm to help stabilize, and then knees to chest, protect that low back, and then you can do the same sequence of breathing in and out as you open up to the side. Now, we have 2 sides of our body, so I recommend you also do both sides just to incorporate some equal love. You know, if you work on this side, why not give this side some love? Again, using the recommendations of self-palpation to make sure you're staying above the rib cage and not harming your low back. So if you have any questions, always reach out to me, and I look forward to providing you some new fun self-care techniques next time. Thanks, guys. Remember to subscribe to this channel, and if you found this tutorial helpful, leave me a comment or maybe a like. Bye, guys.